Hello, everyone. My name is Maureen Muthinzi. I work for Penda Health as the Senior Partnerships and Public Affairs Manager. Penda Health operates 18 outpatient medical centers. The focus is primary healthcare. We are level 3, and we work around preventive and promotive healthcare. My topic was on centering women in health, which is something that I'm passionate about when it comes to women's access to family planning health rights. The project sought to equip women leaders to champion family planning as a health right, influence policy budgets and access through training and storytelling. Also, connect the women with decision makers in the community to be able to drive accountability and advance reproductive health. Overview of the project. Nearly 45% of women in Mathare North have unmet family planning needs. And this is attributed due to the frequent stockouts of implants, injectables at lower level facilities like where I work, which is a level 3. Then USAID's transition, which has strained county family planning budgets. Women voices remain underrepresented in reproductive health policy making. I chose to work with 10 women leaders due to the budget constraint that I had. And again, I draw these women from the faith-based institutions, like the Muslims, the religious leaders, the youth organizations, political organizations, disability organization, and community groups. The method I used to engage these women leaders was through group discussions and through filling in of questionnaires. So out of the 10 women who I identified, the women leaders, I was able to get 10 responses from the women leaders. Some of the topical areas that we looked at was access to family planning methods, experience with stockouts, barriers to access, community needs, attitudes toward family planning, and the willingness for advocacy. This was held on 7th November at the Mathare North Sub-County Health Facility. The achievement was having all the 10 women leaders fill in the questionnaires and submit them. Also, I was able to establish a foundation of evidence and voice to support future advocacy efforts. I was able to raise awareness among the women leaders on their health right and equity issue. Also, I created a network of potential family planning advocates and champions at the community level. This is a picture of the 10 women leaders who were filling in the questionnaires. Challenges that I faced: I would have loved to incorporate the Outer Ring women group leaders who form part of the Mathare North women leaders, but due to the budget constraint, I was only able to engage 10 women leaders. Then the FB shortages and limited training opportunities, and then no men who were approached by the community health assistant was willing to participate in this project. The training gaps that I've identified are the myths and misconceptions which continue to linger around on FP, and also advocate for local funding, mobilize community resources, and then also family planning methods for both men and women, and tapping into male champions. The next steps is the training of women leaders, potentially in Feb, subject to resources availability. As a woman leader, I have been able to learn how to be an authentic leader, where I've been able to learn how to listen to others, tap into the different women leaders, or even the community actors, and again, resilience. When I was undertaking this project, it was not an easy one, especially because trying to get access to these women leaders who have their day-to-day jobs and actually bringing them together for one day to be able to discuss and also fill in the questionnaires wasn't something easy, but I learned how to be patient, how to be resilient, and how to trust that these are the people who have who know the pain points and who can be able to effectively be able to advocate for their health rights. So thank you, WomenLift, for this opportunity. I remain grateful, and I take away that indeed we need to work together as women, and women can be able to take this country far.